Hi, I just wanted to call and express my appreciation for the outreach that you were doing today for family members of Gateway Elementary. Just so you know that for us, you gave us some paper products and you gave us some snacks, amongst other things. But those two were the two things that we really needed right now. And I was sick earlier this week, so I wasn't able to go out and get these things. And nor did we have the funds right now to do that. And so my third grader is very appreciative. So I just really want to just from the bottom of my heart say thank you for doing that. Bye.
We're located in the foothills of Pikes Peak, America's mountain. So right here in Divide, where our center is located, we're at over 9,000 feet in elevation. And so the people that live in Teller County are very tough and independent. There are a lot of obstacles to living this way. Up here, we have no public transportation. We have very challenging road conditions sometimes. People are very, very spread out. So Teller County is a rural community. It's a mountain community, largely based around the mining and gaming industries. So we have a gold mine here in Cripple Creek and Victor, and we have one of the only gambling communities in Colorado. So as a family resource center, our role in the community is to connect families with resources that are available. We live in a very rural community, often a resource desert. So our role is really, really important in being an advocate for families and in particular parents in our community, in connecting them through our vast network of partnerships and collaborations to the many resources that they need for their family to thrive. And we do this through a number of different programs. We focus on increasing protective factors for families. Many of these protective factors are really aligned with the social determinants of health. So just by helping families create goals and create a pathway to financial stability and supports that parents need, especially working parents, like childcare, social connections. These kinds of things contribute to the whole health and the well-being of an entire family. And so that's the role that we play. Our programs cover everything from parenting education to early childhood programs. We have GED and workforce programming. We have healthy living offerings like community gardens and nutrition and exercise classes. And we have a number of different case management programs. We have a lot of traffic typically through our community in the summer and in the ski season, so we're really feeling that impact. The residents of Teller County have a value of independence, kind of a rugged independence and an appreciation of living that wild West frontier life. We have a shared value of appreciation for nature and the outdoors, fishing, hunting, cutting your own firewood. People really, really appreciate living off the land and being independent, some completely off the grid. And what I appreciate most about our community is that access to nature, being able to just walk out your front door and hike and kayak and go camping. And we're really, really proud to raise our children that way. They're very comfortable and confident in the skills that they need to appreciate the outdoors. So many of the things that Teller County residents appreciate about their community, the privacy and the independence and the isolation, also can, under certain circumstances, become risk factors for families. Isolation in particular, poverty, those are major risk factors for child abuse and neglect. And unfortunately, Teller County has historically had a pretty high, at least compared to the state average, rate of the incidence of child abuse and neglect. A few years ago, several of us leaders in Teller County, we got together and we created a child maltreatment prevention plan. And this group, there were 18 of us that spent many days together with a hired facilitator to really, really go through the strengths and weaknesses of our community and to create a plan around the improvements that we need to better serve the families here. And a lot of those improvements in our plan focused on not letting families fall between the cracks, not giving them the runaround, not giving them handoff after handoff, really changing the way we refer families to one another, changing the way we partner with families, we walk alongside them and let them lead, and changing the way we work together and communicate. And it had a huge impact on our community. And as a result, for the first time ever, our child abuse and neglect rate was less than the state average. And we do attribute that largely to our group effort to really, really rally around families. We're really, really looking forward to the day when we can see our families face to face when they're in school and we're more accessible to them for support.
Well, my answer might be a little bit more deep than other people's, but I would recommend community partnership because it can literally save lives. My son was 3, joined playgroup, perfectly healthy kid, never even had an ear infection, and we found a tumor. So I love all of the programs at Community Partnership, but I would have to say that for me personally, the Parents as Teachers was my favorite for myself because I was able to learn a lot about my kids. They do the ASQs where we learn about the developmental milestones that the kids reach. They get quizzed for fine motor skills, gross motor skills, and things like that to make sure that the kids are on track for their age. And then we also get the results to know what we need to be working on. And sometimes as a mom, that's kind of hard. We can either be biased, we compare to others. So it was really nice just to have this information so that I could always know like what the kids needed to work on individually. Playgroup, my kids loved. That was more fun for them. They also love Parents as Teachers, but playgroup is full of crafts and singing and music. So playgroup would be my second choice for a program at Community Partnership. And then my third would be I think it was called First 5 Years, was a class I took to learn about kids 0 to 5. I learned so many things about myself, my parenting techniques, also techniques for discipline, because at that age you're dealing with terrible twos and so many things like that. One of the most important things I took away from that class that I still use, and now my kids are older than that, is to give them choices. There was a whole section on how kids are pretty much control freaks, and if you give them a choice between two things instead of telling them what they'll do, that it really does help not have so much conflict, and that worked wonderful for my family.
Yeah, so Jack has a tendency, they call it BRUIs, which is a brief resolved unexplained episode. It's my favorite term. And basically what that means is at any point in the time, laying down, eating, sleeping, anything, he'll just stop breathing. He tenses up and starts to shake and his eyes get really big and he starts to turn blue. And at that point we have to turn him over and do backflows and clear his airway and suction out his airway. And we don't really know why he does that. He just continues to kind of do that. He's on 8 different medications, several for reflux and 2 different inhalers for his breathing, as well as on oxygen. So there's so many different programs that Community Partnerships offers. The ones that have specifically helped us so far, we're in the Family Support Services program, and what they've done is just provide support for me as a mom to kind of get through this because it's a lot. And in addition to that, they've given us resources to get food when we needed it, diapers, wipes, those kinds of things. We've also been a part of PAT, and it's been really helpful for me because my 3-year-old is really active, and it's hard for me to plan my own activities while trying to make sure Jack stays breathing, and so it's really helpful to have that availability and her to just talk with us about where they're at developmentally, so I keep track of it instead of letting it slip through the cracks. They also did this really cool thing where we went down to the grocery store and got to see, a cooking batters class and see where things are located and how to read the labels and talk to each other about like what kind of foods are better and better for the bang for your buck with the nutritional value that you need, to keep your family growing. And we all got to just hang out together and talk about like different recipes that we all needed that none of us had and share what we know with each other. And we really like to do play group. The boys get to play and hang out. It's hard for us to get there as often as we'd like to because of all those hospitalizations, but whenever we can come, we don't feel like we're shamed because we don't get to go every week. We still get to come in and be welcome and have a good time with all the other kids. It took a lot of fighting, but you guys, Community Partnerships, encouraged me to keep going and not stop and get what he needed done. Yeah.